All right, good evening, everyone, and welcome to ATP Live Monday, whichever platform you're joining from. I'm Bimi Boyde, and my pleasure to be here with you today. Welcome, and I'm so glad our Instagram is working today. Awesome. So, if you have any questions, this is ATP Live Monday. This is a program where you get to ask any questions that you may have about the health of your children, and you get immediate answers live from a pediatrician. So, welcome everyone. I'm going to just share the video and make sure everybody can see me and can hear me. If you are there already, just let me know you are there. I'll also just go uh, make sure I welcome everyone. Welcome. If you're coming, please share the video, share the link, and let everybody see us and hear us. Okay, I'm just going to do the same here. Um, let's see. Okay, I think we are live now. So I'm just going to share the video. Share now. Okay. Okay, I'm just sharing to my story. Okay. All right. Let's share to the groups. So, welcome everyone. How has your day been? Um, this is ATP Live Monday, where you get to ask any question you may have about the health of your children, and you get immediate answer from a pediatrician. Okay. I'm just sharing and making sure people can see, and I'm also trying to pin it to our groups. Let me just check Instagram. People can't see anybody. Okay, somebody's joined us on Instagram. Naomi Hadetona, you're welcome, and Dara, thank you so much for joining us. Okay, so let's just share the video, share the link so that people can be aware we are on live now. And I'm just trying to also just make sure I pin it and so that people can see me and they can hear us. So yeah, okay, yeah, pin posts. Okay, and then let me just check the groups. Welcome. If you have any questions about the health of your children, you can start to drop your question while we're doing the sharing. Start dropping your question now. You don't have to wait. Remember to start with the age of the child. Remember to tell us what your concerns are, and then we will answer them. I'm just trying to make sure that people can see us and hear us by sharing the video, and then we can start. Welcome everyone. I hope you've had a lovely Monday. Uh, and I hope we're almost at the half of the year. I hope your year has been beautiful, and even though you may still have some things you've not yet achieved, there's still like half of the year, and a lot can still happen. So I hope you all are enjoying also for those in in the Western countries. I hope you're enjoying your summer. All right, so I think I'm done with the sharing. I think I'm done with the pinning. I hope I've put it everywhere. So, but if you have any questions, so feel free to ask your question now. Uh, yes, I can see you. Thank you so much, Instagram people. Instagram is working now. We're back on the normal Instagram. Just let me know you are there, and we can start. All right, so I think we are done, and I think we can start. Good evening, everyone, and welcome to Ask the Pediatricians Live Monday. I am Mr. Lavoide. I'm a pediatrician, and I'm here this evening to answer any question that you may have about the health of your children in the next 1 hour. This program is brought to you by Ask the Pediatricians Foundation, and Ask the Pediatricians Foundation for the last 10 years. We are committed to the health and the well-being of your children, and we do that through our online platforms on social media, Facebook, Instagram, YouTube, our what's it called, podcasts, and all that. We provide health information, health education. We are your companion in making sure our children are alive and they are healthy. We also do community outreaches offline to indigent communities, and we've been doing that for the last 10 years, and we're actually celebrating our 10th anniversary come July. So you guys should watch out for all the lineup that we have. So today is just one of our programs where you get to ask any question in live in 1 hour, and you get your answer straight from a pediatrician. Remember that you can still ask questions after the live session. You can go to our Facebook group, Ask the Pediatricians, put your questions there. We are there from Mondays to Saturdays, and we will answer your questions. So thank you so much for joining me today. Just a reminder that if you are watching on the groups, any of the groups where we have shared the link to, you have to click on the video to put your questions, otherwise we will not see them. But if you are watching directly on our page, Facebook page, or the Instagram or the YouTube, you can just drop your question directly under the video and I'm going to say it. All right, so thank you so much. The first question I have is from Abisola Jejelola. Good evening, ma. What can be used for PAL in children 2 years plus? Thank you for your question. And number one, that question, I'm smiling because it's one thing that we've addressed several times. And from what I've learned, when people use the word jedi, pal, they are not referring to one thing. And I actually did a survey on Ask the Pediatrician, and I asked people to translate what they meant when they use the word jedi, like translate it to English, describe it. And I kid you not, we got over 20 different responses. So people use the word jedi to means, I'm going to be using the medical terms now. People use it to refer to a child who is having diarrhea with blood. That is dysentery. People sometimes use it for even rashes. People use it for children who have rectal prolapse or anal prolapse, like something is coming out from the anus. People use it to refer to hemorrhoids, which is when you have some what we call veins that have blood that have coagulated in them and they're coming out of the anus as well. People use it to refer to rashes, to even cough, to all sorts of things, to back pain. So what I found out that when people use the word jedi, they don't have a particular word. They don't have, it is not the same thing everybody is saying. Okay, so because of that, it's best for you not to use that terminology, and it's better for you to describe to me in everyday language, this is what my child is doing. Don't go by what people have told you. Oh, it is jedi. Somebody is passing watery stool, is passing blood in the stool, is having the anal prolapse or rectal prolapse or hemorrhoids. Everything is jedi. Somebody is having back pain, somebody is having rashes, everything is jedi. So it is not a, it does not mean one thing in medical jargon. It means like over 20 different diseases. So I don't, it's one of those native local terminology that we don't take. So I'll rather, so I always separate, don't tell me what you think the diagnosis is, or don't tell me what you think it is the cause or the problem. Just tell us in simple everyday words what you can see in the child. My child is passing watery stool, something is coming out from my child's anus, something, this, just describe it in simple everyday word. Don't use a particular term. Okay, then that way I will know exactly what you meant, and then I will know the right medical term for that, and then I can advise you. And I've written an article about jedi jedi and all that, because it's one of those most common thing that people do. And while I'm on it, please don't give our children any so-called agbo jedi jedi. Don't give them herbal mixture. Don't give them herbal concussions. Most of those herbal mixtures are made with all sorts of things, including alcohol and a lot of things inside them that we don't even know. And some of these things are very, very dangerous to the kidneys, to the liver of our children. That's why people end up with liver failure, kidney failure when they're still so young, because all these things we are, we are giving our children, we don't know the impact they're having on these organs inside them. So please do not do that. So if Abisola, you're still listening to me, just tell me in your own everyday word what exactly is the symptom that you can see in your child, and then I'll be able to answer that. Okay, Instagram, I can't see anybody on Instagram. I hope they can help. I'll log in on the right platform. Okay. Good evening, Fama. Thank you so much for joining us. It's nice to have you too. Thank you so much. Let's go to the next question. So your question, Ifama, is what causes green pigments in babies too? Okay. She's almost 3 months old and on exclusive breastfeeding. Okay, so green. So there are different kind of presentation when it comes to stool and when it is green. So you see a child who is passing watery stool and it is greenish, or very scanty stool that is greenish, or is a child that is passing normal, what look like normal stool, well-formed stools, and there is now green pigment in it, because that will also determine the kind of answer we gave. Now, if a child is passing what look like watery stool or very little scanty stool and it is completely greenish, we tend to get that in what we call starvation stools. And starvation stool basically means that child is not getting enough that child is not getting enough food, he's not getting enough um, breast milk, because where does the green come from? The green is actually the bile. Most of us, when you kill your chicken, that green thing that you normally remove, that's the gallbladder, and what is inside it is the bile. So that bile is produced in the gallbladder, which is around the liver, and it is meant to color stools. Okay, so if somebody does not have enough food and therefore nothing to be digested, nothing to be passed out, then what you just end up passing out is the bile. The bile is meant to come and color the end products of digestions and make it a little bit brownish when it's mixed with it. But if there's nothing to mix with, then the child is going to pass out that almost the bile itself, and that is why we call it greenish stool. So it's always a sign that that child is not getting enough food, or like in this case, breast milk. However, if a child is passing what look like stools that is normal but is having like greenish pigment in it, that could be from pigments that the child has been exposed to from what you eat as a mother yourself, for example, or what the baby is eating. Also, sometimes you can get it, some for those who give the babies formula. Some formula can give your baby's greenish coloration to the stools, or even some drugs depending on what you're taking. So that could be from pigments that the child is exposed to from food, from drugs, anything that passes through the breast milk to the baby. So that is another possibility, but most of the time it's usually um the starvation, the child not getting enough. Sometimes we also have it in a child who is having, for example, a swollen tummy, then abdominal pain. When we have intestinal obstruction, you can also have that, but that is usually more dramatic. So the greenish stool is not going to be the main thing. The main thing will be the child's tummy being swollen, the child is vomiting, the child is having distended abdomen. So we know there's something emergency. So the child may actually be vomiting greenish. Actually, it's more of vomiting of the greenish stuff in intestinal obstruction, but you can also have a little bit of it in the stool as well. So I hope so if your baby is passing, having well formed stools and just a little bit of grain in it, so that may be from maybe what you are eating, and that may be what is being passed to your baby, not that there's any starvation. I hope that is helpful. All right. If you not, if you want further clarification, feel free to add it to the question in the comment section. Omokaye Adeyinka, good evening. Is watery egusi pool normal in a 7 month old baby? Yeah, it can be normal. We tend to get that in babies who are on breast milk. So if you're 7 months old, you are not yet giving a lot of solids, then you can still be having that picture. But usually for your 7 months old, we expect you to be giving them complementary food. So their stool should be changing from what you get only when they're on exclusive breastfeeding to something well formed. So the question is, have you started that baby on complementary food? And is the child taking the complementary? Of course, you should still be breastfeeding, but you should be doing a lot more of you should be adding the complementary food alongside the breast milk as well. All right, if I must say, my 11 weeks old still feeds her hands. Sometimes she opens them, sometimes. Okay, so it's a little bit tricky the way you've asked your question. I think what will worry us as a pediatrician is if the child is always keeping the hand fisted. And you will notice that when you want to open the hands, it's so hard to do it. It's not like, just try closing their hands and they're opening it or something. But if the child's hand is always like that, fisted, closed, and it is always closed, especially when the child is awake, and when you even try to open it, it's like it's hard, it's a little bit tricky to open it, then we will worry about that, because that will be a sign of what we call hypertonia. That will be a sign that the child is stiff, and that is a sign that there's something going wrong in the brain, and we really need to see that child. But if it's just that once in a while the child closes their hand, other times, it's not like the child is always like that constantly. For children who have hypertonia that are feasting, is their hands are always closed and very difficult for you to prise it open. So that is a sign of hypertonia and a sign of a neurological problem, and that kind of a child need to see a pediatrician. But if the child's hand, he's a little bit closed, but even before you touch it, it's open and all that, I will not worry about that. But if your child has had a difficult beginning, like maybe the pregnancy was difficult, delivery was difficult, baby did not cry as birth, the baby had meningitis, baby was premature, and you are seeing those signs, then I will recommend you see a pediatrician as well, because those are babies who are already high risk for neurological problems because of brain injury, maybe because they didn't cry on time, they were born too early, they have infection in their brain. Those kind of babies, any little sign you notice in them, you see a pediatrician first, because normally we should even keep them under for regular follow-up anyway. But if you notice anything, those kind of babies, you see that. But if it's otherwise, baby, the body is not stiff, the hands is not like it's fisted. Fisting means it's really, really close and tight. So it's not just mild closing of your hands or something like that. No. So that one you have to see a pediatrician for. All right. Radike Bami Kefa, good evening. Thanks for all you do. Thank you too for joining me. My baby is 7 weeks old, very active, okay, but spit up, coagulated milk a lot during the day and at night. She doesn't really do that. Yeah, but it's okay for babies to have reflux. What your baby is having is what we call reflux. So reflux is a normal thing in babies, and explained it multiple times why babies are prone to having reflux. Number one, babies have very small tummy and they are eating what is a liquid food, and then the gateway, what closes the space between the stomach and the esophagus, it is not well formed. The sphincters, they are not well fully developed, and most of us, once our baby has finished eating, then you just put them flat. So you have a short distance between the mouth and the stomach that is very small. You have a liquid diet. You have sphincters that are not yet well fully developed, and then the baby is in a flat or prone position. So it's just so natural for the liquid milk to return back the way it's coming, and that is what is causing the reflux. And it can be, it varies from one baby to another. So maybe it's just very minor. So maybe it's actually very much more severe. So what we normally recommend that when you feed your baby, keep them upright. Don't just put them flat. Leave the leg gravity, give some effect. So when you keep baby upright, the food stays down. Before, if you go put them flat, the food just return back. But if you keep them upright, you keep them upright for 15 to 30 minutes. It allows the milk to settle in the tummy, allows some digestion to start taking place, and things moving along. That way, when you now put the baby flat, it can still return, but it is not going to be as serious like if you put them down immediately. And most of the time, it should just be mild, and we don't worry about a little bit of spit up and all that. I think we worry if your baby is bringing out almost all the milk, is vomiting, or the milk is coming out from the nose, is coming out from the mouth, maybe it's almost shocking, and then that is when we are going to worry about it, because that will be severe reflux disease. Because there's a difference between just reflux that most babies will have as long as they're on liquid diet, to reflux disease where the child is losing weight, the child is vomiting everything. For those kind of children, we will have to treat them. So we have what we call medications to give them. We will have to thicken the milk sometimes. So actually for preterm babies, we thicken their milk. So we give them milk thickener, something that will make the milk a little bit thick and stay down. And then we can give them some antacids and stuff like that. So those are the things we would do in such babies that are very severe ones. But if it's just a little bit of spit up and all that, we are not going to worry about it. It's something that children will outgrow as they get bigger, as they get older, and they are now beginning to sit up. The chances of reflux go down, and by the time they are completely on solid diets, then reflux is gone forever. So I hope that's helpful. So if it's just a little bit of spit ups, I'm not going to worry about that. Bami Kefa, I hope that is okay. Um, okay. So you said, does it applies with the tools as well? Yeah, if it's very difficult for you to see fisting in toes, but if your child is always folding the toes, yes, it's also a sign. You need to. It's usually babies don't even fist their toes. Normally they don't. They tend to actually keep it fanned out and all that. So if the child is constantly calling the toes downwards, you really definitely need to be seeing a pediatrician, because again, that may be a sign of a neurological problem. I mean, it's okay to see a pediatrician. I always tell people, if you're worried about your baby, it's better to come and see us and let us tell you, okay, I know sometimes someone will be like, oh, maybe the doctor will scream at you or something. And no, we don't, we shouldn't be screaming at you. It's better to come and see us and tell us, I don't know what it is, and we examine the child, and we can tell you straight away, oh, there's nothing to worry about. At least then you can go home and be reassured. But it's better than coming to us very late. We always want you to come early. The earlier the better. All right. So I will, since you're having these concerns about the fingers, about the toes, and all that, I will just recommend that you see a pediatrician for a quick check. Let them just check that this child does not have any neurological deficits, and that if there is, let them start to deal with it. Okay. Instagram people, I can't see any question from you. Please, if you have question, put your questions. Start with the age of the child. Just tell us the age, tell us the concerns you have, and then we can answer the question. Just keep it short and simple. Shoyoyo Basira, say thank you so much. Thank you so much for joining me as well. I don't think I have any questions still. Okay. Yeah. So while we're waiting for question, let me just remind you that our Ask the Pediatrician 10th anniversary is in July, and we are celebrating the whole month of July. Yeah, okay, I have some question now. I'll come back to that. It's going to be from the 1st to the 31st. Every day we're celebrating ATP at 10. So just watch out for that. Okay, gifted Mercy. If I what if a baby doesn't cry at birth? Is it a month for the nurse to beat the child hardly? No, okay. Thank you so much for your question. Let's start by saying the nurse is not beating the baby. We are not supposed to be beating the baby. That's not the idea. Okay. I know sometimes people do the wrong thing, but that's not the idea. The idea is that if a child does not cry, let me first teach you a little bit of physiology. So when your baby is in your womb, that baby depends completely on you, the mother, for everything. The baby is a complete parasite. It depends on the mother for food, for hair, for oxygen, for everything, even for eliminating waste product. That is what your placenta is. So the placenta has blood vessels coming from the mother going to the baby, and coming from the baby and going into the placenta and onto the mother. So all the nutrients, the oxygen, everything the baby needs just goes straight from the placenta to the mother. I mean, from the excuse me, from the placenta to the baby. Now, all the waste products comes back in the placenta and the mother will eliminate it. Now, when your baby is born, what do? We cut the cord. So that cord is the where the placenta, the mother and the baby are joined together. That is the where the nutrients are flowing back and forth. So that is what we cut. Immediately the baby is come out of the mother. And what that means is that that baby is now completely independent of the mother. The baby is not going to get oxygen from the mother. The baby is not going to get any food from the mother. So from the mother's bloodstream. So that baby needs to start using his or her own organs straight away. And the most important one is that the baby must use their lungs to breathe. They must breathe, they must take in air, because all the oxygen they were getting before is coming straight from the mother. Now the baby has lost disconnected from the placenta, so no oxygen is coming to the baby from the placenta anymore. The baby has lungs. The same way you breathe in and breathe out, the baby has to start breathing. Okay, and that must start straight away. Within the first 60 seconds the baby is out. Okay, so if a baby comes out, most babies, 90% of our babies will come out screaming and crying. So that screaming and crying, they are breathing in oxygen and they're exhaling carbon dioxide. So that is how the this, and then their lungs is functioning, and we're happy. The doctor is happy, the mother is happy, everybody is happy. That is why we want babies to cry about. It's not like if we are we are wicked people, but babies have to cry. It is the crying that makes them to take in air, take in oxygen, expand their lungs, and their lungs will start to function. And that is very important, because the baby have very sensitive organs. The brain is one of the most sensitive organ in the body. The brain is completely dependent on oxygen, on glucose, and all that. And the brain is so sensitive that if the brain does not get oxygen within 5 minutes, the brain will start to die. Yeah, that is happening. The brain cells start to die straight away. So we need to make sure that that baby starts to breathe within 60 seconds, what we call the golden minutes, so that oxygen will get to the brain. Otherwise, some brain cells are going to die straight away. So that is exactly. So how do we get the baby to? So like I told you, most babies come out squealing and they're crying and they're breathing, no problem. But 10% of babies come out not crying and they are not breathing. So we need to help them to breathe. So that is what we call resuscitation, neonatal resuscitation. And what we normally do, there are simple things we do. Number one, some babies, we just need to give them a little bit of stimulation. So it is not beating the baby. All they need to do is to rub the baby, stimulate them, just drying the baby. So usually when they come out, they are coming out of the amniotic fluid, they are wet and they are cold and everything. So we just put them in a blanket and we just dry them and rub them, put them under the resuscitator, the warmer, give them some heat. That process of just rubbing them is the stimulation. We don't need to beat them like as if as if you are beating. It's just rubbing and stimulating them. But some people do it like as if they are beating the baby. They don't need to beat the baby. They just need to rub the baby and stimulate the baby, and the baby will start to cry. And that is what some babies will need. Some babies, there are some, maybe the water, the mucus is blocking their nose, and we just suction them gently, suction the mouth and then the nose. And most of them, that will be enough for them, and they will start to breathe. Of course, some babies do not, even you've rubbed them, you've suctioned them, they still don't breathe. So what we do, we give them a little bit of what we call positive pressure ventilation. We use the amber bag, we just make them, pump them a little bit just to help them to breathe on their own. And sometimes our babies, that's all they need. And most of our babies will start to breathe on their own just doing that. And we give them oxygen, they are fine. Of course, sometimes we have about 1% of babies who will not cry. Who, after we have done this initial, all this is I'm saying we're doing like drying the babies, suctioning them, we're doing it within 30 seconds. So some babies will still not do that, will still not breathe. And those are babies that will now start to, we may have to, pass in an airway, we may need to give them other extended resuscitation, and we are checking that the baby is breathing because we are working with time. 1 minute is a golden minute. After 1 minute, we're running out of time. After 5 minutes, if that baby is not crying, that baby has gone into what we call birth asphyxia. That means that baby's brain is already at risk of injury. And, even though we may be able to succeed in getting baby to breathe again, but we may have lost some of the brain cells because the brain is a very sensitive organ and the brain is not fully matured at birth. Only 75% of the brain is formed. The brain has to still grow to 95% in 5 years. So if a part of the brain dies, that is the end of that part of the brain. The brain does not grow back. It does not regenerate. Once a part of the brain is gone, that part of the brain is gone forever. And so that is why it's so crucial that we take care of babies. This is why you don't deliver in places where they don't know how to resuscitate babies, where they don't know how to help babies breathe. Most of us are lucky, like I said, 90% of babies don't need any help. All of them come out crying on their own, they are fine, they don't need our help. But there will be that small percentage of babies that need our help to breathe. And if you deliver in a place where they don't know how to help that baby to breathe, and all they do is to beat that baby or be putting fire or whatever, most of those babies, either they will die, or if they don't die, they are going to develop what we call brain damage, birth asphyxia, their brain, and then they start having convulsions, and some of them will have disability in future. So that is what we're trying to prevent, which is why we say you register for antenatal care, because sometimes if you register for antenatal care, we're able to know ahead that this baby may have problem breathing. So we are there with the pediatricians. We're there. All professionals who take delivery of babies, including the gynecologists, including the midwives, including the nurses, including the doctors. All of us are trained on how to resuscitate a baby. Anybody may have to be called upon to resuscitate a baby. But if it's already an high-risk baby, a pediatrician has to be there at that delivery. So it is not just anybody. A pediatrician is there. We are ready. We have all our equipment ready, oxygen ready, everything ready. So baby is coming out. We're taking the baby. We're doing all we need to do. That baby must breathe. Okay. And we're trying to make sure that baby is breathing within 1 minute. So because that is a golden minute. All right. Otherwise, we start to lose the brain, and brain gone. That is it. We can't recover the brain. So that is why it's so important that you register in an antenatal care and you deliver in a hospital. Even if you're going to deliver in a church or all those places, which we don't recommend, make sure they have trained professionals, skilled birth attendant. That's what we call skilled birth attendant. I want to go and deliver in Baba Lagbo's house. These days, we're actually going to teach them, because this day we realize some mothers, no matter what you do, they want to still go to deliver in CBA, Halagbo's house. So we go to actually teach the TBAs how to do this resuscitation as well. But if you don't want to put your life, your baby at risk, deliver in hospital where you know that they can resuscitate your baby, because those things are time sensitive. 5 minutes, that baby must be crying. Baby not crying after 5 minutes, we are we're going to be dealing with complications in future. So that is what we're trying to avoid. So I hope that explanation is clearer for you to understand why it's so important and all that. So Radical, if the spit up is too much, then you have to take your baby to see a pediatrician so that they can evaluate your baby. Like I said, some babies just have minor reflux, but if you think it's really, really much, then you have to see a pediatrician and they can take it up from there. Thank you, Basira. Thank you so much. Happy anniversary to us. Um, so, Fifama is saying, is it possible for an SB level of 18.5 to cause brain damage? Jaundice can cause brain damage. So there are lots of factors that determine at what level jaundice will cause brain damage. Stand number one, is this baby a preterm baby? Is this baby a term baby? So if it's a full term baby, a jaundice of 18.5 is not yet severe. We tend to wait for, like, if it is 20, then we know that that is the level it can cause brain damage. But if it's a baby that was born premature, weighing maybe 1 kilo, even the jaundice of 10 in that 1 kilo baby is too much and it will cause brain damage. So it is not just the value, it is the value versus the baby. Is this a preterm baby? Is it a small baby? Is it a big baby? Then are there other problems with that baby? So this is a baby who didn't cry about, now he's having severe jaundice. Of course, there are more issues there that we have to deal with. So jaundice is also an emergency. I see a lot of mothers will tell me, oh, my baby has jaundice. We just went to the hospital and they just told me to go and give ampiclos, or they just told me to go and give pawpaw water. Those are dangerous hospitals. Those are dangerous doctors, okay? Anytime your baby has jaundice, you must go to the hospital. They must do a blood test for the baby. They must. These days, we are having technology where we don't need to do blood tests. We can do what we call transcutaneous bilirubinometer, but they must measure. That is the key word. They must measure the level of the jaundice. It is not by looking. It is not by feeling. Because even we pediatricians, we look. It gives us an idea, but it is not 100%. Even the transcutaneous method, I'm telling you, it's not 100%, but there's a level it will get to, you know, you need to take blood. So for us in Nigeria, where we don't even have all this technology, please take blood. If your baby has jaundice, they must take blood. They must do that blood test that same day. You are not supposed to go home and say, I'll come back the following day. No, you stay there and get that result and know what it is, because that is what will determine whether your baby is going home, or whether your baby is going under the lights, or whether your baby needs a blood transfusion straight away. Again, jaundice can damage the brain. And so this is why, so I've talked about oxygen, not getting oxygen to the brain can damage. The brain is in a newborn baby, the most important organ that we're trying to protect is that brain. And a lot of mothers come and give testimonials. Doctor, the doctor said I'm going to have CS. Well, I thank God. I'm a Christian too. And God, I didn't have CS, and I deliver my baby by myself. Hebrew women, it is not you delivering the baby that's our problem. Most of you will deliver your baby whether they do CS or not. The question is, at the time you're delivering your baby, is the brain still intact? The brain of the baby is the most important thing, because every time you're stressing during labor and all that, oxygen is being cut off. Oxygen supply is not getting to the brain, and the brain is dying. That's what it means. So when sometimes we notice that this baby is already stressed and oxygen is not getting to the brain, we want that baby to be delivered by the fastest method possible. So we say we want a cesarean section, not because we know you won't deliver, but because we want the brain intact. So it is one thing to have a baby, it's another thing to have a baby whose brain is intact, who will not later develop developmental disability. So for us, I'm a developmental pediatrician. That is my goal. My goal is not whether you have a vaginal delivery or whether you have a cesarean section. It doesn't really matter. What matters most is that you have a baby whose brain is intact, because otherwise you're going to be dealing with that for the rest of that baby's life, and it is a long journey. So it's better to prevent than to be dealing with the consequences. So that is number one for oxygen and the brain. Number two is jaundice. Jaundice can also cause brain damage. So, and there's a level of jaundice that will cause damage to the brain. So every time you see a baby who has jaundice, and please, let's not be carried away with, let's do naming ceremony first, let's do this one. I see a lot of mothers in my clinic, maybe has jaundice, they will not go to hospital because they just don't, they want to do naming ceremony. Naming ceremony is not important. It's for you and for your friends. It's not for the baby. Baby doesn't even know what you're doing. So if your baby has jaundice, you have to go to the hospital, not health center. No, you have to go to hospital, like a minimum of a general hospital. I don't even like people taking newborn babies to health center. They can't do anything for babies in health centers. Go to a general hospital or a teaching hospital, a hospital that has a pediatrician there, so that they can take the blood and do a test. If it is lower and it's okay, then your baby go home. And we know we don't have to worry. We may ask you to come back for 8 hours. We can check it again. But if it is high, we may have to put the baby under lights. And if it is too high, we have to change the baby's blood that same day. So that is how important it is. Okay. So it is important that we are aggressive. I always tell mothers, if you come to ATP, jaundice is an emergency. It is not something you just decide, oh, I'm giving ampiclox, I'm giving people. Most of us get away with all these things because most of the babies have mild jaundice. Most of them have mild jaundice. So, and because people that their babies have mild jaundice would think because they are giving purple water or they are giving ampiclox, that's why the babies are fine. No, you were just lucky that your baby is not having the severe jaundice. So don't follow your friends telling you, when my baby had it, I just gave purple water and everything was fine. That is not the purple water. The jaundice was mild. So whether they don't do anything or not, the jaundice will go on its own. We all know jaundice, even for severe jaundice, it will go on its own. Even if you don't do anything for jaundice, it will always go. The question is, when the jaundice has gone, what has it left behind? What havoc as a rock before it leaves the baby? So that is what we are trying to prevent, and that is why we want to know the level of the jaundice. If it's a mild jaundice, luckily 60%, 80% of babies will have mild jaundice. Most of them will get away with it, nothing will happen to them. But those 10 to 20% that will have the severe jaundice, if we don't treat them, those are the ones that are going to have brain damage and they are going to have lifelong disabilities. So baby has jaundice, you must go to the hospital. We must take the blood. We must know the level. And that is what determines. I don't, all this one that they just say I should go and give ampiclox. It is not true. Ampiclox is not the treatment for jaundice. Purple water is not the treatment for jaundice. Early morning sun, it helps with jaundice, but why do you know whether it's the one that early morning sun is going to help or it is the one that we need to be changing the blood? So we need to do the blood test first. And it is not those blood tests you go home. Some of you go to those hospitals, they will tell you take blood, come back 3 days. No. Jaundice blood test, you sit there. They must do that test in front of you. They must bring out the result within 1 hour. It is an emergency blood test. It's not something you go home and come back 3 days later. No, you wait there and get the result before you go home. And a pediatrician must see that result and they must tell you, don't worry, or yes, we are admitting your baby, or 3, we are going to change your baby's blood. It is so important. Otherwise, we are going to be dealing with brain damage at that time. So it is important. So if a baby has had difficult deliveries, baby has had jaundice and all that, and you start seeing any sign in those kind of babies, there are babies that we call high risk babies, and those kind of babies, any concern in them at all, you must go to the hospital. You don't stay at home and start wondering whether it is or it is not. You just have to go to the hospital. I'd rather you go to the hospital, see one of my colleagues, and then we tell you, okay, we are not worried, but if we are worried, we will tell you what to do. Okay, so I really am passionate about brain of the baby because that is my field. Okay, I deal with babies that have brain injuries and disabilities. So for me, it's very important that you protect the baby's brain when they are born. And another thing, before I answer, while we're still on baby's brain, since that seems to be the focus of today, all these ones that we allow our baby to fall anyhow, you are damaging baby's brain. Mothers, please don't let babies carry babies. Don't let all your children, 2 years old, 5 years old, be carrying your newborn babies. Please don't. Don't put your baby on chairs, on couch, and leave them. They will roll and they will fall and they can damage the brain. So which is even more painful. At least maybe people had a problem at delivery or maybe had meningitis or had jaundice. At least you knew the problem. But you've had a baby that was perfectly normal brain, and then you take the baby home and you allow all these unnecessary accidents to happen to the babies and cause brain damage. It's very painful. So please, babies, don't carry, babies, okay? And all this one will throw babies up and down. Please don't do it. Stop it. It's not necessary, and it's a dangerous thing to do because baby can slip from your hand and they can fall. I see a lot of mothers saying, "Oh, my baby fell and he hit the head," and we say it so casually as if it is not a big deal. It is a big deal because, like I told you, the brain of a newborn is still developing. That brain is only 75% formed. That brain is still growing up to the age of 5 years when it will be 95% developed. Any injury to that developing brain can lead to permanent disability. The brain do not recover. If you have a wound or a cut on your skin will heal and you may leave a little mark, but it will heal most of the time. The brain does not heal. Once the brain has been damaged, that is it. That part of the brain is gone. It's only the rest of the part of the brain that will be growing. And if it's a very crucial part of the brain, maybe responsible for walking, responsible for this, responsible for that, that is it. We can't recover it. Right now, technology, we can't recover a brain that is dead. So we really need to make sure we keep our baby's brain safe from all these unnecessary insults and injuries. So I think I will stop there now. All right. Gifted is saying, what causes fluid in the brain? That is when the fluid does not absorb. I'm not sure what you really meant by what causes fluid in the brain, but I guess you are talking about hydrocephalus when there's excessive water in the brain, because there's water in the brain normally. Okay, there's water that surround um the brain. We have what we call spaces in the brain called ventricles, and there's a water that circulates around the brain. We call it cerebrospinal fluid. So there's no more water in the brain. Okay, now when we talk about a baby that has a big head because the water is too much, there are many reasons for that. It's either there's something blocking because the water is being produced, and as it's being produced, it's also being removed. So fresh ones are being produced, old ones are being removed. I'm just trying to keep it very simple for you. It's a little bit more technical than that. But if there's a block along the pathway that the water flows through, it flows around the brain and all that down to the spinal cord. If there's any block somewhere, that water will not be able to go and it will build up, it will form pressure. And that's why if you see babies there, what we call the fontanelle will be very tense, and sometimes the baby will have big head. Now, the problem with that is that water is pushing against the brain and it will start flattening the brain. The brain will start to become flat, and that is brain dying as well. So sometimes babies are producing too much water. That is why. Sometimes there's a block. Sometimes baby has infection, and because of the infection, like meningitis and all that, the water is not. They cannot absorb the part of the brain that's supposed to absorb that water into the blood, so that it can remove. It's not able to do that work, and then you have what we call hydrocephalus, so too much of water in the brain. So what we normally do, we can do an operation to create a opening for the water to flow. We can, create what we call a shunt that will connect the water in the brain to somewhere in the abdomen or somewhere so that the water can flow out. So there are operations we can do. The key to that is recognizing it on time and doing the operation on time. Because if we don't do the operation on time, the brain has been damaged. We cannot recover the brain that's been damaged. But if we do the operation on time before the pressure has caused a lot of brain damage, then the baby may still be fine. So it depends on the cause. There are many causes. It depends on how quickly we picked it up and how much of brain damage has happened before we did the operation is done. So that is about. I think you're referring to hydrocephalus. If that is it, just let me know. If not, just clarify again. But I think that's what you're asking. We have written article on it. You also have a information leaflet on hydrocephalus on our Facebook group. Just ask, somebody will send you will post the link for you so you can read more about it. Okay, there's a question on Instagram. Lorita Mall, how are you? Okay, is it okay to add fluoride inside baby formula? You mean the one that they've already added, or are you the one adding it? Because I'm a bit confused. So if it is the one that the manufacturer have added, like a supplements in the formula and all that, of course, that is fine. But I don't want to add anything to your baby formula on your own. Okay, don't add any fluoride to the formula for babies. Your babies just need breast milk. 0 to 6 months, breast milk only. Everything you need for the baby is in the breast milk. You don't need to add nothing to it. Okay, from 6 months, keep breastfeeding and give your baby solids. The baby do not really need any of these formulas. That is your honest truth. Your baby do not need it. As long as your baby is breastfeeding, all the milk, all the thing your baby need is in your breast milk. If your baby is 1 year old or after 2 years, when you stop breastfeeding, you can give them the same milk that you also take, and they'll be fine. So, but please don't add anything on your own to the formula of the baby. So, but if it's an ingredient that's been added, because all those formula, all those products, they should go through NAFDAC. That is the job of NAFDAC, to make sure that the content is what they said it is, and it is free from germs and all that, and all the things they put inside is approved and is okay for consumption of human beings. That's the job of NAFDAC or FDA in US and all those organizations. So if it has NAFDAC number, it has gone through NAFDAC uh, scrutiny and all that, then they should be fine. It should be safe. But remember, all these organizations too, it's human beings that are there. It is not spirits, and we all know human errors abound. So you also want to minimize unnecessary risks and exposure of your baby. All right. Udra says, is there any medical condition like jedi that, okay, I think, are you just coming, Udra, because I think I've answered that question at the beginning. So just, there's no one medical condition called jedi. You know, people use the word jedi. Even the people that use the word jedi, they don't always use it for one thing. Okay, if you go on our Facebook group, just type jedi, you will see the survey that we did. We asked our members, ATP members, what do you mean when you say jedi? And we got over 20 different answers, from diarrhea to dysentery to rectal prolapse to anal prolapse to hemorrhoids, all sorts of things, even rashes, even cough, even back pain. So many things people refer to as jedi. So it is not one word. It is not, it does, I don't know the people that coined it. You know, people coined it at the beginning, may have meant something, then people that are using it have used it to mean other things. So for us, I don't generally even like people using jargons, whether medical, whether native, local. Just tell me exactly what you see in your child. My child is coughing, my child is passing stool that is watery, there's blood in my baby's stool, my child has this, something is coming out from the anus or whatever. It's better to say that, and let us be the one to translate it to medical condition for you, rather than for you to tell us it's jedi. We don't know what you mean by jedi, because like I said, when we asked people what they meant by it, they gave us over 20 different answers, and I'm not exaggerating. They gave us over, if you go to our Facebook group, I think we did that maybe 6-7 years ago. Maybe we need to revisit it, but I've told you it's better to tell your doctor. And that is only jedi is just one of them. People also talk, another one that people tend to use a lot is ela this, ela that, or inra, whatever. Most of those names are just, people use them for rashes, but there are so many different kind of rashes, from fungal to the bacteria to the allergic kind of rash to the atopic dermatitis to all sorts of things. But people just, everything is ela. It's not, everything is not ela. It's not ela. It's not one word. It's so Yoruba people tend to use ela a lot for a kind of skin rash. But even under that, there are so many types, you know. So there's a skin rash that you need an antibacterial. There's a skin rash you need an antifungal. There's a skin rash that you don't even need to do anything. You just need to stop what it is you're exposing your baby to, you know. So there are different things. So again, for medical professionals, for pediatricians, tell us exactly what it is that you see. If it's a rash, take a picture of it, show it to us. A one picture sometimes is worth more than 1,000 words. But please don't take picture of genitals, don't take pictures of private part of children, don't take pictures of children unclothed. It amazes me how often parents will disregard the dignity of our children. We just take pictures of children naked and post it on social media without any, and I'm like, can you do that for yourself? Of course you won't. So you think the baby doesn't have a right to their own privacy? So please, if you want to take a picture, make sure the child is wearing nappies or diaper. If it's something in the area unfortunately you can't post that, then you have to come and see us in the hospital, and then we can look at it for you. So, but please don't take naked photos. That's why we reject some of your posts. Some of you asked, you put our group in a lot of trouble with Facebook, and now we're very strict about it. So I noticed that our group has gone back to good standing now, because we don't allow those your naked photos on our group. All right, so uh I think that is about that. So it's best to tell us exactly what. And please, while we are at it, don't give your baby so-called agbojedi jedi, all those things. Babies do not need any drugs whatsoever. They don't need. And some of you always ask questions like, oh, the hospital, they didn't give my baby any drug. Like, why does the baby need a drug? The child does not need to be taking drugs every day. For what? Children do not need any drugs at all. So when you deliver your baby, all you need to do is take your baby home and give breast milk, bath the baby, keep the baby clean, give food. Oh, that's all. You don't need to give them any drugs. Of course, go for your immunization to protect the baby against future infections. But the children do not need all these vitamin C, your nospamine, your Bona Babe, your grape water, all sorts of things we give our babies. Very unnecessary and very dangerous. So please don't give it to them, just let them be. Okay, I hope that is clear. I think our time is up. We have 5 minutes left. I don't have any question on Instagram people seem to be very calm and quiet today, but I can see you are there, you're learning. Thank you so much. So while we are let me just tell you a little bit about our anniversary coming up. Is well before my 5 minutes run out, because it's starting on the 1st of July, and I don't know whether I'm still going to do another ATP live. Okay, I think I'll still do one more ATP live next week. So which will be the last month is Monday, so which is the 30th of June. So that's lovely. So I'll be able to tell you more about our anniversary on that day. So every day of the month, we're going to be celebrating ATP at 10. And what we want is for you to tell us, you can do a 1 minute video of your ATP experience, your ATP testimonial, your ATP impact. We're going to feature it. And of course, we're going to be showcasing all our journey uh, for the past 10 years. And of course, we're going to be celebrating all our wonderful volunteers, all uh, our moderators, all the people that have contributed to where ATP is today. So just watch out for that. And if you have any testimony, anything, you can always let us know. So just watch out for all the flyers, all the events. We're going to have our ATP quiz. We're going to have our ATP anniversary dinner, which is going to be on the 20th, which is the ATP day proper. Luckily, it's a Sunday, so we're all going to gather together. We're going to celebrate. And so just watch out. We're going to have loads of events, but we want to showcase, we want to read from you your stories of ATP. We want to tell us how ATP has made a difference to you since the last 10 years. Tell us something unique, something that you want to tell us about ATP. So, who is this person greeting me about the baby? I didn't have a baby, but no, I know what you meant, Sha. You said, what's the number for a 20-month-old baby to pull on each feeding? Yeah, baby can pass stool after every feed, as long as the stool is not watery. There's nothing to worry about. So don't nothing to worry about. We worry if the stool is watery or if the stool is hard. But passing stool after feeding is perfectly normal. We call it gastrocolic reflex. It's just a stimulation, and the stool the baby is passing at that time is not the food the baby just ate, because I know that is where most mothers' mind goes to, that, oh, that means that as the baby is eating, the baby is also passing it out. No, that food that the baby is just eating is going to take another 8 to 12 hours before it will get to that point. The process of digestion, moving from one end to the other, from the mouth down to the anus, is going to take another journey of 12 hours. So the stool that the baby is passing out is the one that has already been processed, that has been digested, and that was the end product of that one. So it must have been the old one that the baby has, not the one the baby is eating currently. So you don't need to start panicking about it. All right. Okay. So I think that is that. So I was just telling us about ATP anniversary. I should have shown you. Okay, maybe next week I'll show us the full program outlook and everything we're going to be doing, and we just watch out and start to prepare your own testimonial. Do a 1 minute video. We'll put it on our Instagram. We'll put it on our Facebook. Put it on our YouTube channel, and also we're going to also want you to give back to ATP. Of course, you know we're going to do a lot, and everything we've done so far has been through generous donation of paper, and we're going to do our raffle ticket, and so you're going to win something as well. And of course, there'll be ATP quiz and so many more. All our different chapters, we're going to showcase them, we're going to celebrate them. So watch out for all that from July. So the whole of July is ATP 10th anniversary celebration, and it's a 1 month celebration, and it's going to be massive. It's going to be loud. So just to watch out for that. So thank you so much for joining me. But if you still have any questions, you can always go to our Facebook group. You can ask your questions from Mondays to Saturdays. We are there for you to answer any questions that you may have. So please be patient. Please remember to not put pictures that are that Facebook doesn't like. Nude pictures, it should not be allowed at all. So just ask a question. Something that you really need to post something, and you have to go to the hospital for those kind of pictures, because we cannot allow it on social media, for obvious reasons. Thank you so much. Have a wonderful, wonderful evening, and I'll see you again next week. And this will be the last ATP Live Monday before our 10th anniversary. Of course, there'll still be some special live also during our 10th anniversary. Just watch out for that. Thank you so much, and have a wonderful, wonderful evening. This is bye-bye from me. Bye.